Stem cells and growth factors are injected directly into the supratentorial region of the brain. A neurovascular catheter is navigated toward the sigmoid sinus using cath lab imaging guidance. Each IJV is temporarily blocked to release the cells. The cells start filling up the enclosed cerebrovascular space. Cells force through the pores of the cerebral venous sinuses and spread throughout the supratentorial and subarachnoid spaces. The temporary block is removed. Then, an indirect central arterial administration targets all major arteries of the brain to induce angiogenesis. Artery endothelial regeneration is systemically induced using differentiated cells. Angiogenesis at the capillary endings of the basilar artery boosts oxygen-rich blood flow to the substantia nigra, enhancing dopaminergic neuron function. As small vessels heal, the inflamed ischemic lesions begin to shrink. After administration, the catheter is safely removed. Immune responses can cause abnormal electrical crosstalk between nerves. Crosstalk between nerves is caused by loss of myelin due to the shortage of oligodendrocytes. The loss of insulation between motor and sensory nerves causes neuropathy that originates from referred pain. Central pain processing errors cause misinterpretation of the origin of the pain signal. Preemptive cytokine-mediated immune modulation is induced to deter lymphocytes from attacking endothelial cells and oligodendrocytes. A neural cell formulation, including oligodendrocyte progenitors and neurotrophic factors, is injected via intrathecal administration. As nerves myelinate, the brain adjusts neurotransmission, which can cause temporary changes in symptoms. Oligodendrocyte progenitors differentiate, locate, and insulate neurons. The injected neural cells encompass the entire spinal column and the brain. Neurotrophic factors mediate neurogenesis across inflamed, non-fibrotic lesions. Introduced neural precursors activate cerebellar stimulation. The brain enters a stimulatory phase to reconnect to individual muscle groups. Persistent cerebellar activity stimulates broken motor pathways, forcing a response from lost muscles. New motor responses return to the brain. Spasticity increases as the brainstem upregulates motor stimulation. This effect gradually subsides. Physiotherapy is crucial after the neural cell transplant to enhance motor responses. The neural cells carry out repair over several months following the treatment. In advanced stages, lifestyle challenges manifest as secondary symptoms stemming from musculoskeletal deficits. Headaches accompanied by neck and shoulder stiffness, weakness, numbness, and pain in the arms. These symptoms originate from nerve root compression in the cervical spine. Psoas muscle stiffness and sciatic pain are typical symptoms of lumbar radiculopathy. Nerve root compression worsens neurological symptoms in patients with limited ambulation. It is crucial to address the musculoskeletal causes to control the lingering symptoms of radiculopathy. Foraminal stenosis, intervertebral disc bulges, and herniations constantly impact the nerves branching off the spinal cord. Severe disc degeneration, abnormal spinal stress, and aging can lead to intervertebral bone changes and severe back pain. Wheelchair-bound patients or those with limited ambulation remain in seated postures for extended periods, leading to uneven intervertebral stress and degenerated discs. Cartilage-regenerating cells and a growth factor concentrate are injected around the affected intervertebral disc. A dose of neural cells and neurotrophic factors closely follows the first injection. The formulation helps restore the intervertebral disc's mass, reduce inflammation, and repair the affected neurons. The entire spinal column is closely examined to plan this procedure, and each affected disc is injected. Reversing radiculopathy largely depends on the regeneration of the herniated intervertebral disc. Healing of bone spurs can take up to a year. Regular stretching helps alleviate vertebral stress on the nerves, offering support after treatment and also preventing future compressions.